About 3 years ago, we start this new trial surgical technique. At first, it had encountered several difficulties, but with the maturation of single-port surgery in various thoracic procedures, we think it may be feasible. So we select from a simple, straightforward case. And when we move on, we think, unfortunately, the clinical result and the patient outcome is quite satisfactory. So we decide to move on this novel procedure, and afterward we think we can acquire the clinical result as we done in we call normal minimal invasive esophagectomy. So we decide to popularize this procedure in our daily practice. I think now we have seen that the perioperative outcome is quite comparable to that we have in the traditional minimal invasive surgery, including the patient recovery, the number of lymph dissection, and patient performance. So we are quite confident about that. We publish this result in sequencing in the European Journal and Surgical Endoscopic. And I think it's very helpful in the help. I think we just on the way to the enhanced recovery of the after surgery with this trend. I think this the meaning in this result. What is I think to confirm the feasibility of the single-port surgery in the thoracic and the abdominal part. And even in the complex, as we know, the esophageal surgery is a complex procedure. And even in that complex procedure, in the reconstruction and the extensive lymph dissection, we can perform with this approach. So maybe it can popularize to more in the future. And the other one is that the patient with such a difficult disease such as esophageal cancer can benefit from the improvement of our novel surgical technique. So I think the surgery itself is a treatment, but the treatment itself, the surgery, is not a perfect treatment because it is a lot of cost of the patient, including the inconvenience of the surgery and surgical trauma. I think after it is an incomplete procedure, in our surgeon's part, we have the duty to improve this procedure to make the patient have the best chance of recovery. So it is these two things I think important. It is to further confirm of the single-port surgery in the thoracic part, and from the move, it is possible for moving on in treating esophageal cancer patients with better survival, with equivalent oncological outcome and better post-op recovery. I think in the lung cancer surgery, it has been moving on and changed a lot from our modern treatment modality and also the diagnosis. First of all, we have a diagnosis from CT screen. So we almost more than half of the patient go to our department to receive lung surgery is early stage lung cancer. So surgery play a very vital and crucial role in the treatment of early stage lung cancer now. And the second, with the advance of multiple oncological field, including target therapy, immunotherapy, and also the improvement of chemotherapy. The patient have the more chance of survival long term, even with they have advanced stage. And from I think in our institute we have some novelty in the treatment of lung cancer in surgery, including in the early stage and the advanced stage. In early stage, I think minimal invasive surgery is the trend we have to go, and including minimal invasive, the minimal invasive we also have the effective treatment. So the minimal you have the balance between minimize excision and adequate resection extent, and because this disease is a very good long-term outcome. And so the goal of the treatment of the patient is a cure. And any kind of disease progression or disease recurrence, I think is most acceptable to the patient and to the surgeon. So how to decide the effective excisions and localize the patient. So we from this aspect, we in our department, our colleagues had developed intraoperative CT localization and dye localization, and also we have used the navigation system and magnetic bronchoscopy and navigation system to localize the lesion during the surgery. I think we have a move from the traditional to localization with the CT guide to endoscopy, bronchoscopy navigation to localization of the tumor. I think it is a movement. In the next, we hope can incorporate with some interventions strategy. Maybe can apply this novel instrument to intervention or treatment of the patient. It is the early stage. In the other one is advanced stage cancer. Advanced stage cancer in our institute, because we have also do several cases interested in robotic surgery. In robotic surgery, we found it is the option of minimal invasive thoracic surgery, but can also provide the quality of dissection and tissue manipulations during the surgery as good as we done in open surgery. So we have published our results. Previously, we complex procedures such as sleeve resection or the tumor with dense adhesion or difficult location or deep-seated location of huge tumor. We think this complex procedure may be useful in the future, but the only important condition is that the patient is familiar and overcome all the learning curve of this novel surgical technique. So I encourage the young surgeons to keep his mind open to all this procedure, although he has not several disadvantages. But you have to make yourself familiar with that. Only you are familiar with that, you have to know which is limitation and which is advantage can provide to you. And this is after that I think robot it cannot replace all the vast procedure in the future, but it still has some role in treating certain population of advanced lung cancer or certain disease pattern of the patient in the future, especially in the thoracic surgical field. And the second one is about advanced cancer is that we find as we have applied photodynamic therapy in treatment of patient with pleura disease, we found because the patient, if the patient with pleural dissemination, but just a limited pleural dissemination, no other distant metastasis or renal metastasis, just only that. It sometimes will cause, we sometimes have the regret for the patient, because the patient has just only limited disease but cannot be cured with modern treatment modality. No matter the target therapy, chemotherapy, or surgical resection, it cannot solve the problem of local recurrence in the pleura. For such kinds of patients, we have performed multi-modality treatment, including chemotherapy or target therapy, and radical lymph dissection and tumor resection, and maximal removal of the radical removal of the pleura nodule, and that we can, in conjunction with photodynamic therapy, we found it is very effective in local control of the disease, and thus perform the patient with long-term outcome. We have published 2 years ago in the PLOS-ONE, and in our preliminary data that the 5 years survival can be as good as the stage 2 lung cancer. The 5-year survival can reach as high as 50%. And when we moving on, keep on treating the patient and collect more patient population, and we found the survival data is quite stable. So we also report in this World Congress of Lung Cancer annual meeting in the Yokohama. The survival data is the same as we seen 2 years ago. So I think that the data is quite convincing. With photodynamic therapy, with radical resection, and multi-modality treatment modality, the patient can be given with a better chance of long-term survival in the future. And that is what we've done in our department, for my part, in our team, for treating lung cancer. Oh, I think it's my interesting. I just for me, the care of surgery itself is not just my work. I enjoy the chance, because it's not only the cutting and give medicine to the patient. Also, he provide a platform to. I like to have communication with several different field of friends, and I enjoy to have a communication with all the patient when they had touch with me, especially in the outpatient clinic or in the ordinary. I found that each patient had the disease pattern is represents a habit, the habit of the life, including the diet and including your lifestyle, and with the lifestyle is the disease. So each disease has extended some problem of the patient. So we just only solve the disease, but we didn't solve the problem for the other part of the patient. So maybe he has some drinking and alcohol. He has alcoholism, so maybe he has a problem in his family, and then nobody care him, because when he was young, he was healthy, he didn't care anybody in his family. So for each patient has his problem, but the other patient has a good family support, but has some in the psychological or the other problem. So from this part, I have developed such foundation and association and facility to include more manpower, and when I care the patient. And from this year, I think it helped me a lot in caring the patient, not just only the surgical part from the medicine, and we can from the aspect from the economic and the social, and from the patient education. I think for this is the most powerful in patient and provide a good platform to have just a real communication with my patients and the real help. I just make a joke to my students and to my colleagues. I think because the surgical outcome is much improved as compared to previous we had. So not only for the lung cancer patient, also esophageal cancer patient. Most of the patient can survive long term in our after the surgical treatment. So the patient come to my clinic every 6 months or every 3 months, and after they receive the surgery, they have become a good friend with me. I make a joke. Once I surgery for a patient, I become a family doctor for the patient and for his family. And any problem, physical condition, or even psychological problem, they will come to me. But I think I didn't have time to solve this problem. I am fortunate. I think we are thanks to my colleagues to help me to handle such things and try to help the patient to have a normal life, not only the physical condition. I'm most impressed with is that the patients. Once I received a patient with esophageal cancer, once because he is very depressed because he think it's a very terrible disease. His lifespan is very limited. So he will pass away in the very near future. But after treatment, I think nothing happened. He still lived long, but he's still in the very dismal and very low emotion status. I encourage him. You can go out and work as living as a normal people and working as normal people. And he after that he accepted my suggestion. He come back to his work. Although the salary is not high. So when he come back and go back to his normal life, and the first salary he buy some fruit to me. This is my first salary. I will make some present for you because of you I can have this salary. So I think it's quite impressive. And I just take the fruits from the present from him. I think it's worthwhile, although it takes some time in addition to my work. So we were moving on from this association to help to complete care of the patient, including education. So from this one, we have the regular patient education, not only the medicines, how to exercise, how their diet, how they're living, and how to control their emotions, even every aspect. I think it help, and also help on the relationship between the patient and the doctor. Because I graduated in senior high school. I graduated in Jang-Ming Senior High School. It is in Taipei City. In Jang-Ming Junior High School, there are many Chinese teachers coming from mainland China. They are very traditional Chinese scholarship. That is as we have seen in the old textbook, that's Confucius. So my teacher maybe is very happy to when we call him not teacher, we call him 老夫子. It means very old scholarship. Yeah. And I enjoyed the teaching from my teacher because he gave me the real, genuine, traditional Chinese education. And the education I enjoyed influenced me and deeply when I'm young and deeply seated. Actually, from this reason also I have to play some Chinese traditional practice such as Tai Chi, Chen, and Kung Fu. and it is a Chinese traditional Chinese concepts, including Tai Chi and I Ching, the Bible of change. I think it's a very the crystal of wisdom of the Orient, such as Tai Chi. I think it's a real practice and a very good chance to understanding why the traditional education and the philosophy has done from the usual exercise. Also, actually, from my concept, it is not just exercise. It is some kinds of philosophy. With understanding of the philosophy, you can to change your physical condition, change your emotion, your every physical and also mental status. I enjoy a lot of exercise. So from my junior high school, I had to make a habitual practice of this exercise. Actually, when I'm in university and I am the doctor, I also met many master, kung fu master, and they also give me a lot. I like this communication because for me it opened the door to see the other aspect of the world. Actually. Some of the teacher mentioned to me, you are a human being, happen to a physician, not a physician, happen to a human being. So for me, to be a physician to a surgeon is just a work, but you found the work to have the feeling of how to get the innermost part of the life. I think it's my privilege and advantage of the doctor. I enjoy this advantage or privilege. This is why I also keep my habit of exercise. For me, it is just not exercise. All this sometimes of the traditional concept or traditional philosophy. Sometimes I am asking how to treat the disease, how to handle the difficult situation because it's our physician. But actually, for me, it is just the work. From the work I just mentioned, from the work to open the real world. So I always encourage my student to keep open-minded to not only just in the medicine, and you have to extend your focus once you have your capacity has equipped. But for a surgeon, the most important, you have to fully qualified surgical skill and medical knowledge. It is your duty to solve the patient's most important problem. But once you have such capacity, you just cannot state or certify, just only state. You have to change your lifestyle to make some progress. They will give you see the different diverse level of the life. So sometimes I have some friends who is maybe is some talking about how the philosophy and talking about how the traditional concept. I more enjoy the talk with my friend or with even my my senior with such aspect. As I'm rather interested in the philosophy, philosophy, especially in the traditional philosophy, such as in the Taoism, or in the Buddhism, or in any kind of comparison, or Oriental and this and Eastern part. I think Eastern and Western part, from their different lifestyle, but the final goal is the same, the happy life. The happy life. With the happy life, you have to have the good physical conditions and very wealthy life. Nothing deficient in your life. But also, it's very important to have the sufficient no problem included from the emotions. So if I have a chance, I am very happy to talking about the philosophy. But I don't think I have such the chance. Okay.